This will be our epithelium laboratory. And this first slide shows simple squamous epithelium shown by these flat cells near the surface. This is a section through mesentery, and this simple squamous epithelium on this mesentery sheet is given the special name mesothelium. You can also note a simple squamous epithelium that lines blood vessels. You can see that here, and you can see a little bit of it here and here. When the simple squamous epithelium lines blood vessels, we give that the name endothelium. Near these little capillaries, you can also observe some connective tissue cells. So there's probably a fibroblast here, and this is probably a mast cell. Here is a profile of the mesentery as though you were looking down from the surface. So you don't see the nuclei in these planes of section, but you can see these flattened cells, and you can see the cell outlines in this preparation of the mesentery. This particular stain is a silver stain. It's a rather unusual stain. Here is simple cuboidal epithelium that's lining thyroid follicles. In this case, the simple cuboidal epithelium in the thyroid is given the name follicular cells. Here is the thyroid colloid, which is actually a thyroid hormone which is stored extracellularly. We'll talk about the dynamics of this much later in the course, and we'll also talk about the parafollicular cells, or C cells, in the thyroid that are involved in synthesis and secretion of calcitonin. Some of these C cells would be located here, for example, where my pointer is. I would never expect you to recognize that this is the renal medulla at this point in the course, but the collecting ducts in the renal medulla consist of a simple cuboidal epithelium, and you can see that nicely outlined around any of these cross sections of the collecting tubules. The blue stain that you see in some of these slides is staining connective tissue. These are trichrome stained slides, and usually the blue stain is picking up connective tissue. We'll have more to say about connective tissue later in the course. Here is a simple columnar epithelium lining the mucosa of the small intestine. You can see the single nuclei in the epithelium. You can see the brush border, which you'll recall from an earlier presentation. These are microvilli along the brush border. Here is a goblet cell, and then you can see some lymphocytes that are actually invading this epithelium. Well beyond the scope of what I'm expecting you to know right now, but the area that I'm in here with my pointer is the lamina propria. When we talk about the GI tract, we're going to talk about particular layerings, and I don't want you to worry about that right now. For now, I just want you to recognize this simple columnar epithelium. Here, a profile through the jejunum in the small intestine, also a simple columnar epithelium. You can see the nuclei. Here you can see a goblet cell, maybe another goblet cell here, and you can get a sense of the brush border. And then this region, again, would be region of lamina propria. For now, if you just understand that the lamina propria is essentially a connective tissue on which an epithelium sits, you'll be fine. Here is a profile of a large striated duct, probably taken from one of the large salivary glands. This striated duct also consists of a simple columnar epithelium. You can see, as I would trace this cell like that, a simple columnar epithelium. The striations, you can see these basal striations. This is an area where there's membrane infoldings with a lot of interdigitated mitochondria, and once again this would reflect active transport, and in these large salivary glands, these striated ducts function to concentrate the secretion of the salivary gland. We'll have more to say about that later in the course. And again, a trichrome stained slide, so the blue is picking up connective tissue. Here's an area in the small intestine, again a simple columnar epithelium. I think we showed you this slide in an earlier podcast. So here you can see the nuclei, here you can see the brush border, the lumen of the GI tract here, and several goblet cells are highlighted. This is a profile through the oviduct. It's a ciliated simple columnar epithelium, and here you can see profiles of the cilia. We'll have more to say about the oviduct later in the course as well. How do cilia differ from microvilli? That's one of these questions I'll leave for you to try to discover on your own. This is a profile through the epididymis. The epididymis, of course, is in the male reproductive tract, and this is a pseudostratified columnar epithelium, and these epithelial cells possess a surface specialization called stereocilia. The stereocilia are seen like this. Stereocilia are essentially long microvilli. What would their fine structure be, and then how would these fine structures of these stereocilia differ from that of cilia? You can also note basal cells in this profile of the epididymis, and these basal cells are indeed stem cells. This is a pseudostratified columnar epithelium, and we know that it's pseudostratified because if you look at the nuclei appear to be in very staggered layers. Here's a view of the trachea, again a pseudostratified columnar epithelium and a ciliated pseudostratified columnar epithelium. Here is a goblet cell, maybe another goblet cell here. Notice the nuclei are at staggered layers, and you can clearly see the cilia on this epithelium. A ciliated pseudostratified columnar epithelium is often given the name respiratory epithelium because that's essentially the only place in the body where you find a ciliated pseudostratified columnar epithelium would be in areas of the respiratory tract. Here is a profile of the vagina. I would never expect you to recognize that at this point in the course, but it's a stratified squamous epithelium, non-keratinized or non-cornified. You can see multiple layers of cells, and it's defined as a stratified squamous epithelium because the top layer of cells is squamous or flat. You'll come to appreciate that anytime we have a stratified epithelium, we define it by the shape of the surface layer of cells. So here a stratified squamous epithelium because the surface cells are flat. Here is connective tissue underlying the epithelium, so in the lamina propria if you want, and I don't expect you to recognize this right now, but this is probably a profile of a small nerve. I also don't expect you to pick these out right now, but these cells might be melanocytes. Here is another profile of non-keratinized stratified squamous epithelium. The surface is actually off the histological image, so it's down here. But again, a stratified epithelium, and notice that as you're going towards the surface, the cells are getting flat, so we define it as a stratified squamous epithelium. Here is a stratified squamous epithelium, keratinized. The surface layer of cells are actually dead. They're cornified or keratinized, so we would correctly identify this epithelium as a keratinized stratified squamous epithelium. And then, again, some connective tissue underneath the epithelium. This is a section through a large duct, probably from a salivary gland, and it's reflecting the fact that this is a stratified columnar epithelium. Notice the surface layer of cells is columnar. There are two layers of cells in this area, so it is stratified. We define the epithelium by the surface layer, so we call it a stratified columnar epithelium. Now you have to be careful because in some areas, here we're getting like a tangential section through this duct. This would almost look like a pseudo-stratified epithelium, and in some areas you almost think maybe it's a stratified cuboidal epithelium because the epithelium looks more cuboidal than columnar. So sometimes this is a judgment call, but I think like in an area like this, there's no question that these surface cells are columnar, so stratified columnar epithelium. Here is a transitional epithelium. This epithelium is unique to the urinary tract, so you might find this epithelium in the ureters or in the bladder or in the very proximal portions of the urethra. But very characteristic of this transitional epithelium are these very large dome-shaped cells that would project into the lumen. And here's another view of the same thing on this next slide. It's a stratified epithelium, but we call it a transitional transitional epithelium, because this epithelium has the ability to change its shape. It can be very much stratified like this. I don't have a view to show you, but if the bladder, for example, is very distended, this epithelium can spread out to almost look like a simple squamous epithelium. So a transitional epithelium, it can change its shape depending on the physiologic state of the organ, the characteristic dome-shaped cells. Another interesting feature about this transitional epithelium, oftentimes transitional epithelium has what are called polyploid nuclei. Look at the size of this nucleus compared to this nucleus. This nucleus is probably a 4C nucleus, where this nucleus is probably a 2C nucleus. Sometimes you can see cells that are binucleate in transitional epithelium.